Good morning, my lovelies. So tomorrow I'm going to have my lower and upper blepharoplasty. Very nervous, but I thought before I go, I've got no eye makeup, we will have a last look at my eyes and what I'm doing to it. So these are my eyes from the front. As you can see, especially on the outer corner, they are really drooping. You can see them, my lids sitting on my eyelashes, and I don't know if you can see the lower skin on the lower lid. It's all really loose and hanging, so I'm having the skin removed on the top, and I'm having a cut right here and the skin pulled up. I'm not sure what he's going to do with this. Can you see where my lid is drooping? I have like this fold here. I don't know where that is going, but I'm sure he knows what he's doing. So as you know, I'm going to be documenting it, so I will see you tomorrow in hospital. So I'm about to go in. I have nice markings and I will see you after. Okay, before I turn the camera around, I just need to warn you, if you are squeamish, if this is going to upset you, don't watch, because I'm about to show you my face. Okay, so it has been, oh God, I don't know, I think it's about 2:30. I was taken down for the operation at about 8 in the morning. So I was back here, I don't know, but I've been fine now for about 3 hours. I've been fine. I had lunch, I've had coffee. I was so dying for coffee. So anyway, I look like I've been in an accident, but I feel fine. It's not painful. It's weird. I suppose my eyes inside feel a bit sore. They keep putting like this ointment in my eyes. I've got like lots of stitches, and look how bruised I am already, because I am a bruiser. So yes, this is just few hours after my surgery. I'm so glad this is over, because you know, I was so worried about the general anesthetic. My friend just came and visited me because she doesn't live far away from here. So I just had a visitor, and I think Paul is gonna come a bit later on. Okay, so this is the day of my surgery. I will see you tomorrow. Hello, my lovelies. I just got home. What a sight. Now, this is looking much better. It might not look like this, but I've really looked at it close up. The reason they look so much more black is these black stitches that are like spider legs all over the place. And also, can you see this eye looks like it's really drooping? I saw the surgeon this morning, and why that is because they put more steri strips here, and one of the steri strips is really low, like almost pushing my lashes down. So, but he said everything looks good. So we will call this day 2. So the day of my surgery yesterday was day 1. Because I had it done first thing in the morning. I think I went in 8. Sorry if I'm repeating myself, but I thought I was with it yesterday, but I actually can't remember what I talked to you about. I'm pain-free. This might look horrific, but it's not painful whatsoever. It's just a bit stiff, you know, because I'm all taped up. So after the surgery, it was just a bit, I suppose, where the stitches are a bit stingy, you know, like as if you cut yourself. But that went in the evening. I haven't had any painkillers, although they send me home with anti-inflammatory. I have eye drops and ointment, and I have to wear these really sexy, you know, the compression socks for 10 days. I am actually exhausted because I slept just for 1 hour. So I've basically been awake for about 27 hours now. Couldn't get to sleep, couldn't get comfortable because you have to be upright. So I couldn't really sleep, so I just watched stuff all night long. And then I fell asleep about 1 in the morning, and the nurse came in at 2 to see if I was okay. So that woke me up, and I was wide awake then, couldn't get to sleep. So I'm really exhausted. Paul just brought me home. So that's what I had. It looks horrific, doesn't it? Oh, it's itchy a bit, but I can't keep touching it. Anyway, I will just pop in every day and we will see how it's going. This eye is, I think it's this eye that is more bruised than this one. But yeah, I'm fine. So I will see you tomorrow. Hello, my lovelies. So this is day 3, isn't it? Wednesday, Thursday, Friday. Yeah, day 3. I don't know if I'm going to come back every day. There is a difference today. You probably can't see it. This eye is definitely better. The bruising is really going, but this one is a bit worse. Yes, I probably won't come back every day because this video is going to be so long. You know, I like to chat. But this is, I want to give you like a really honest, raw way how I feel. Yesterday I had crisis. So I saw you in the morning and I told you that I didn't sleep in a hospital, a wing, and I couldn't sleep all day at home. So I was basically up for 36 hours straight, apart from the, I don't know how long I was under anesthetic. And I felt exhausted and quite depressed, to be honest. And then my eyes are starting to itch, and when they itch and I can't really do anything because I've got all these steri strips everywhere. This one is itching right now. Oh, it's really annoying. And I slept on a sofa last night. I probably got about 6 hours sleep, so I feel a bit better today. But I also wanted to tell you that, and I don't know if it's the anesthetic or the whole thing, we always think about, you know, this is first plastic surgery that I've ever had. You know, I've had some Botox and fillers before, but I've never had any plastic surgery. And as you know, I've been thinking about doing my eyes for at least 6 years. But you know, you have to really, really think about it because I think it has psychological effect on you as well. So yesterday I was sitting here and looking at myself, looking terrible, like dog's dinner, like a roadkill. And I thought, what did I do to myself? And what if I don't like it? What if I don't look like myself? What if I can't do my makeup like I used to? You get all these thoughts running through your head. So you need to think, it's not just the physical, the recovery, but I'm sure it must have some sort of psychological effect. But I don't want to be too dramatic because it could be, you know, the sleep deprivation. Today, I actually feel a bit nauseous and a bit faint. And I just had a phone call with the hospital. And they said, you know, it's probably the anesthetic still in your system. Just drink a lot of water, eat small meals. So it could be that, you know. I think it's just the whole ordeal. And I'm a really, really bad patient as well. I hate people doing things for me, waiting on me. I just hate it. And I hate not feeling right. I just want to be up and doing stuff. even in the hospital, you know, you get the buzzer to call the nurse. I never rang it once. I had to the very first time when they just brought me from the theatre, because the nurse said, if you need to go for the first time, you need to call me. You mustn't go by yourself just in case you faint. So that was the only time I rang the buzzer. After that, if I wanted something, I just walked to the reception, to the nurse's station and asked for something. And they told me, just ring the buzzer, but I just can't do it. So I'm not a very good patient. So that's the part of it as well. I'm a bit swollen under my eyes. Yeah, I am swollen. Like I have big bags. Let's hope they don't stay there. So, yes, I'm having my stitches out on Tuesday. It's Friday today. So I will see if there is an enormous change in the next couple of days. I might come back. If not, I might see you just after I had the stitches out, because then we will have a better idea what it looks like. Right now, no one would want to look like this. Okay, my lovelies, but I might see you tomorrow. Hello, my lovelies. It's day 5. So I didn't film yesterday on a day 4 because yesterday was quite dramatic. It feels so good. I've washed my hair first time in 5 days. I was really scared to wash my hair, but so I've been just showering like from the neck down, but today I had to wash my hair. So, I'll tell you about yesterday in a minute, but look how good this all looks. Well, it probably doesn't to you. I examine it very closely every day. So the bruising has gone down so much. What makes it worse is these messy stitches, because it looks like I have these bloodshot veins running down my cheeks, but these are just those purple stitches. And I have, can you see like this scabby bit here? The swelling has gone down a lot, so it's doing really, really well. I mean, I haven't had any pain from the beginning, so there was no pain ever. It's just annoying. So it's all the other things that you don't think about, like having proper shower, washing your hair. So yesterday, the night before that, I was feeling very sorry for myself. It's just these steri strips, you know, everywhere. My eyes felt itchy, you know, it's all healing, so it's starting to itch. I have to put this ointment in my eyes 4 times a day. After you put that in, you can't see properly for ages. Then I have some drops that I have to put in 3 times a day. Then I have some anti-inflammatory drug that I'm taking. Wearing these sexy compression socks. Can't go out anywhere. So I've been going out with Paul in the afternoon to walk Louis. Try to disguise this. It's impossible because I've got these steri strips. So when I put sunglasses on, you can still see these hanging stitches and steri strips, and obviously you can see them on my forehead. So thankfully, you know, we go around here into places that, you know, try to avoid people. Anyway, yesterday I was sitting on the sofa and I had this like a stinging, stabbing pain suddenly right here in the corner. So I took the mirror, and you see I've got the stitches here. Right at the edge of that stitch there was like a bubble of what looked like pus. So I dabbed it and it was like yellow, and I took a magnifying mirror and it looked like the skin right by the stitch is not closing up. So I thought, I wonder if I have a bit of an infection there. And it was Saturday yesterday, so I called the hospital. They told me to come straight away. So I went to the hospital. Obviously, I couldn't see my surgeon because it was like a, not emergency, but it wasn't arranged appointment. But they managed to get hold of him on his phone. And he said he wasn't worried, but the nurse took all the steri strips off, cleaned me up, put new ones on, and they gave me antibiotic. So I'm on antibiotic now as well, which I am so annoyed about. I hate taking antibiotics. They kill off your gut bacteria for ages. So, but you know, I rather that than actually get infection. Today it looks much better. I haven't had that any pus coming out. I don't know if it was pus, but you know, just in case. So yes, I was feeling very sorry for myself. And these steri strips, another thing is I cannot be happy about it. So I'm just constantly looking at the negatives, what I can't do and what I look like, because I can't tell what it looks like. These steri strips actually pushing on my lid, so it looks like I still have hooded eyes. I can tell, you know, this is looking nice under my eyes, but then I've got like the swelling underneath, so you can't tell. Now I don't know if that's, I've heard that this swelling can last for months because the healing continues. So will I be walking with baggy eyes anyway? I can't tell what my scar looks like. I can't tell what my upper lids look like at all. So I'm like in that limbo. I can't be happy about it because I don't really know what it's going to look like. Yes, I'm a bit stuck, but I have just 2 more days. So today is Sunday. I'm going to have my stitches out on Tuesday. So all this should be gone, and then I will have a better idea and I can go out more because, you know, honestly, I am so pleased with the bruising. I don't understand it because usually it gets worse and worse and worse. It looks really black. In fact, my bruising was going down yesterday. It looked so much better. And I remember do you remember a long time ago, probably 6 years ago, I can't remember if I had a filler under my eye or Botox, and she obviously, you know, poked me in a vein, and I had this huge bruise that was black, and it stayed there like for a month. So this, I am honestly so surprised. It's going yellow now. I've got a bit of a darker bit here and here, but I am using a secret weapon to aid my healing, but I will talk to you about it at the end of this video. Yes, so I think I would look so much better if I didn't have these hanging stitches here. And you know what? This is only 3 stitches on each side, but because they're hanging, looks like I've got lots of them. And then there is one here and one here. What that is, I think, I remember researching this. So, you know, when you have lower eyelid surgery, there is a risk that you can get droopy lower eyelid, basically because the skin is being tightened up and is pulling down on your eyelid. Well, on both sides here, there are little ligaments which support that lower eyelid. And I think that's what, if you have a good surgeon, they do. They hook the stitches to that ligament to keep that support. And I've got here, there is a scab that's come off my skin, but the stitch is going through it, so the scab is like hanging on a stitch, and I really want to get rid of it. I think I don't know what to do with this video. I was going to vlog for 10 days because, you know, I've pre-recorded some videos for you, so when this comes out on Sunday, I don't know if to just do up to my stitches being removed and then in the next vlog carry on. We will see. I'm feeling much better and more positive today. Yesterday, honestly, I think the day 3, the evening, and yesterday were the worst days. And like I said, nothing to do with the surgery. It's just all the other things that go with it, the thing you can't do and that you have to do. It's just a bit much. And the sleeping upright, I'm sleeping on my sofa because it's a recliner and I find it the most comfortable. in bed, even if I arrange my pillows up, it's not comfortable because I suppose your bed goes like this. I have this wedgie cushion, but that's not good. So the sleeping was a bit, but the last 2 nights I had a pretty good night's sleep. So I think I will go back to bed when my stitches are out. I just worry that if I lie down now, that in the night I pull on a stitch or something. So yeah. Okay, my lovely. So I might see you tomorrow, but there might not be much change. If not, I will see you on a day when my stitches are out. Good morning. Don't I look pretty? Right, so just a quick one today. It's just getting better every day. I don't know how that comes across on a camera, but in real life, I'm just a bit yellow now. I had really red spot here, that's gone. I have a bit of purple here and here, and I don't know if there is purple under here or is it those hanging stitches bunched up, so I can't tell. The swelling has gone down a lot as well. It's a bit more on this eye now, and this lid is quite purple, this one isn't, and I still have a couple of bloody scabs there. So not much change. I just wanted to show you how I go out every day walking the dog. So I've got Pulse sunglasses because these are the darkest. My sunglasses are not that dark, I think. So I put these on, but you see, just with glasses, you can still see this and obviously this. So I have them a bit lower like that, and I put my hat on like this, and that's how I go out walking the dog. But it still looks stupid because most of the time there is no sun, so, and I'm walking around in very dark sunglasses. So I can't wait till tomorrow. Tomorrow my stitches are coming out, so all these sticky tapes will be off my face. I'm quite apprehensive because this will be first time when I see what my eyelids really look like. So yes, I will see you tomorrow. Hello, I just had my stitches out about an hour ago and my eyes look lovely, apart from these. So, you know, I had those steri strips. It's day 7 today. Yes, yes. I had those steri strips and all these stitches hanging down, so I didn't realize that I had these 2 bruises under it. This one is a bit bigger. So I'm not happy about that because the rest looks so good. My scar is a bit scabby here, and like here is tiny bit swollen, but you can't really see the scar very well here. This one looks really good. This one looks a bit deeper, I suppose. Another thing that worries me, under my eye, this one, it looks like I've got, you know, he didn't remove any fat or anything, but it looks like a real indentation, and I don't know if it's because this is swollen, so it looks like it. So it's hard to tell. I cannot make a judgment because obviously it's been just 7 days, and your eyes carry on healing for something like 12 weeks, really. Well, they will look fine like next week, but you know, for the tissue to go back to its good state. But anyway, let's talk about my hoods. Well, I don't have any. So this is me with my eyebrows down. Can you see? You can actually see my eyelids, and nothing is hanging down here. Look, I've got lids. It's unbelievable. This one is a bit purple. Yeah, it's very difficult to judge it, but from what I'm seeing now, I'm really happy. And I think I am amazed how this healed. I don't know if this is normal or if it is because of my secret weapon. Obviously the bruising, you can't help that. So I won't talk about it too much, but my secret weapon was red light therapy. And it's just funny how this all happened. About 2 weeks before I was having my surgery, I was contacted by my summer skincare by Bev, who wanted me to try the new LED red light panel and mask. So they sent it to me, so I've been using the panel and the mask. You know, I've been using the current body mask for ages, but this one is different. So this one is like the next generation. It has not just red and near infrared light. You can then switch off between two, and it also has a blue light with red, magenta, and it also have pulsating light, which is the next level that gives you efficacy. So I'm testing all this, but so what happened? She contacted me if I wanted to try them, and I said, you know, I am already using LED mask, but she said this is a bit different. I thought fine, but I told her, you know, I'm going in a couple of weeks to have my eyes done, so I won't be able to really give it a and she got really excited. She said, oh, we must have a call because red light therapy helps with healing. Red light therapy helps with so many things. It's not just for anti-aging. So anyway, I won't talk about it too much, because what we did then, we jumped on a Zoom call to talk about it, and I thought, well, I might as well record it, ask her some questions and post it on my channel. So I just have to record like an intro to it, looking like this, in a couple of days, and I might, if I manage, I will post it on Wednesday. It's really, really interesting. She's got so much knowledge. I mean, her background is in science anyway. You probably know of the My Summer serum, and they've just come out with the My Summer green Roibos spray as well. So I've been using the spray because I couldn't really spread this on my face. So I've been using the spray, and twice a day. In the morning I was using the panel, in the evening the mask. I couldn't use the mask for the first 2 days because my eyes still felt tender, although you have a hole for the eyes. But from the third day I was using the mask as well. And I really believe that it's helped a lot, because if you didn't see my bruises, my eyes just look fine. Obviously I don't have any makeup on. Do you know, this is the longest time I've ever gone without putting makeup on, and I'm fed up with looking a mess. So yeah, I think I have to stay off makeup for another week, because I mean, I can cover these bruises, you know, it's quite easy to cover bruises. So what you do, or you can mix red lipstick with concealer to make it sort of pinky salmony. You put that on first, and then you cover it with normal concealer. Or I have the Huda corrector, which is a bit pink, pink pomelo. So I will put that on first, dab it, wait for it to dry down, and then apply normal concealer. You have to sometimes do it a few times because it's hard to cover, but yes, you can cover bruises, but I'm hoping that they will go soon. I know they can be stubborn, but they seem to be like just concentrated, the darkest in one place, and I can see already around is going yellow, you know. So I'm missing making makeup videos, so obviously won't be making any. Then I'm going away, we're going away soon as well, so I think I will be just vlogging. So I will finish this video here. So this will be like the first 7 days, And if you want to see how I'm getting on, you have to watch my next Sunday vlog. So obviously I will get back to my normal vlog, but obviously I will be talking still and checking with you with my eyes. But yes, so far I am really happy. I still look like myself because I feel like my eyes look bigger, you know, like the eyeballs. So yes, can you imagine I might be able to do a winged eyeliner now? Yes, I must say I was a bit bummed when I saw the bruises because I thought, oh brilliant, but now I can put my sunglasses on and they cover the bruises, because before I had the tapes even lower and the stitches hanging there, so the sunglasses were not covering that. And like I said, I'm not gonna put makeup anywhere near my eyes, but I can just try to conceal a bit those bruises. Let me actually show you when I put a bit of that salmon pink. You have to do that. If you just put normal color concealer, this will peek through. You see how that hides it straight away? I think this is not red enough, so I might have to mix some red lipstick with normal concealer and do that. But you see, it hides it pretty quickly. You need some more there, and then on the top of that you put normal concealer. This one will be much harder to cover, but you get the idea. This is not red enough. So I really recommend you watch this video with Bev that I did. I will try to post it on Wednesday, because she told me so many stuff about the red light therapy that I didn't know. And there is a section when she specifically talks about how red light therapy helps with healing wounds and stuff. That looks ridiculous now. I will take it off in a minute. I just wanted to show you. So hang on, look. If I put the concealer on now, should use brush really, but you see? So it's almost gone. I need a brush, hold on. And just blend it, you see? Look. Mustn't go anywhere near under my eyes. Oh, the removing stitches wasn't very pleasant. Oh my goodness. So the top one was, remember I had it taped here, like the end of it, and the other end here. So it was like a one long stitch. So, because I only saw the nurse yesterday for the stitch removal, and I'm seeing my surgeon in a week's time. So he can have a look at his job, what he did, and if he did do good, if I'm happy. Yeah, they are still there, but you know, it's a bit better. And then you powder it. Anyway, so she just grabbed this stitch and pulled it. It wasn't painful as such, it was just stinging, and I could actually feel this stitch in my eyelid, going through my eyelid. It was awful. And then all these ones and the ones I had on the side, they were so tiny, like knotted. She spent ages there cutting them and pulling them out. These were not painful to remove, they were just really fiddly. So yeah, it wasn't a very pleasant experience, but it was okay. I'm very yellow under my eyes. Oh, that looks better. But yeah, I miss doing the videos and have like a normal routine. But you just have to accept that for the next maybe 2-3 weeks, I might just have vlogs, and I might even post something in the middle of the week, but still sort of vlog style, because obviously I can't do any makeup videos. Can you imagine how exciting it will be doing first eyeshadow tutorial? I probably will do the new Sigma Cool Neutrals, because that's the palette that I received just before my operation. But yeah, I don't know if I will be able, well, it should be easier to do my makeup, but I wonder if it will just look different. It probably won't look much different because I will do my makeup the same way, but just applying it will be less difficult, especially on here where my eyes were really droopy. Okay, my lovely, so this was my first 7 days recovery from blepharoplasty. I hope you enjoyed it. I hope it wasn't too gross because I looked so terrible. That's why I feel that I've healed so quickly, because if you look at me on a day 2, even day 3 to day 7, you wouldn't know I had anything done. It's just those 2 bruises. Okay, I will see you probably on Wednesday, and then I see you next Sunday. Have a wonderful week. Thank you so much for watching, and stay fabulous. I'm not very fabulous, but I will be back to fabulous soon.